Hello there, DangTeach at CCSD, back again. If it's your first time joining us, welcome to the community. We'll continue on our discussion on common drugs and their usage. This is part 3 of a 4-part series. If you haven't seen 1 or 2, go back, watch those, and then continue on with part 3. Okay, for this lesson, we're going to cover cardiovascular agents, dermatological agents, and electrolytes. So we're just going alphabetically through the drug classes. Cardiovascular agents. So, increasing in age, we're all going to probably be prescribed 1 or 2 of these cardiovascular agents. So again, those common abbreviations. MI, myocardial infarction, that is a heart attack. So this is literally heart muscle death due to lack of oxygen. Cerebral vascular accident. Now these are just strokes, anything that's clot, any vascular clots in the brain. We just call them strokes now these days. Hypertension, HTN or HBP, high blood pressure. CHF, congestive heart failure. So just like traffic, the systems and arteries of the heart can also be congested with either too much traffic, in this case too much blood, or not enough lanes. And coronary artery disease. The coronary arteries are the arteries that actually supply the heart with nourishment. So if those become damaged or blocked, it's going to lead to an MI, myocardial infarction. Circulation of blood through the heart. So from anatomy and physiology, you should recall the flow of blood through the heart. So I'm going to ask you a question. If we have congestion on the right side of the heart, where would all the fluid be backed up? Where would you expect to find edema? Where would you find all that water retention? So, right side of the heart, what is preceding the right side of the heart? So we have the vena cava. So that means your extremities will retain fluid. How about the left side of the heart? Where would there be fluid accumulation if congestive heart failure occurred on the left side of the heart? So preceding the left side of the heart, going to be the lungs. So that means your lungs will fill with fluid. So knowing your symptoms, the doctor can predict which side is affected. Conduction, EKG or ECG, electrocardiogram. So you have your pacemaker, the SA node, sinoatrial node, gives you about a 60 beat per minute. It needs to communicate with the left side. So this is the right side. That way, the atriums can coordinate their contractions. The SA node communicates with the AV node. And that sends the signal down the septum and then up the Purkinje fibers to fire the ventricles. And we want the ventricles to squeeze at the same time. If your pacemaker doesn't work, then the AV node can kind of take over, but 40 beats per minute is not highly conducive to life. The waves. P waves is atrial depolarization. So that's when the atrium is firing. So that's this wave here. Then you have your QRS complex. That is when the ventricles contract. So you have your QRS complex here. And then the repolarization of the ventricles we can see here in the T wave. So those are the common parts of the EKG. And from the printout, we can determine heart rate and or any damage, previous damage to the heart. So how does the heart generate electricity? So if you said electrolytes, you'd be correct. So we'll talk about electrolytes later on in this portion of the lecture. Cardiovascular agents, the A, B, C, and D. So A are going to be your ACE inhibitors, B, beta blockers, C, calcium channel blockers, D, diuretics, and the other D, vasodilators. So let's get into the ACE inhibitors first. So it blocks angiotensin, and the name tells you what it does. It tenses up the blood vessels. So it causes the blood vessels to constrict, and that's going to increase blood pressure. So if you block this guy's action, then constriction never occurs. Blood vessels stay open, and your blood pressure is lowered. Similar are the angiotensin II receptor antagonists. So these are lytic drugs that even if angiotensin is in the environment, we block the receptors so it never produces a vascular constriction effect. Beta blockers. So beta receptors in the heart will be blocked. So the pacemaker is going to give you that relative 60 beats per minute. However, the nervous system, the brain, can override the pacemaker. It can send a signal to beat faster, or it can send a signal to slow down. In this case, we're blocking that signal of the heart to speed up. Calcium channel blockers. So the electricity that's created by the heart is through electrolytes. Sodium, potassium, and calcium. So if you block the calcium channel, then there's less electricity. So the forcefulness of the contraction would be less. Diuretics. Just like a traffic congestion, if you have too many cars on the road, to relieve traffic, either you open up lanes or you reduce the number of cars. So in this case with diuretics, we're going to reduce the number of cars by reducing blood volume. So anytime you lose water, you're going to lose salt with it. Anytime there's water, salt goes with it. So the salt that you might lose is potassium, K for potassium. And you will be photosensitive, so stay out of the sunlight. Next are the vasodilators. These drugs will open up your blood vessels, hopefully reducing hypertension. So this uses the other strategy. Instead of reducing cars on the road, vasodilators is like opening up new lanes on the highway. Angina. Angina is chest pain. Chest pain due to lack of oxygen. So there may be many causes. So one is an ischemic attack. So that is when there's a lack of blood flow to the heart muscle, but it's transient. Usually once the spasm goes away, blood flow is returned to the heart and the pain goes away. So it's mostly pain due to lack of oxygen. So other agents can increase the amount of oxygen. So for nitrates, like nitroglycerin sublingual, that's going to help increase the oxygen supply. Beta blockers, they're going to decrease oxygen demand. So if you have to do very forceful contractions, you're going to use a lot of oxygen. If we have a beta blocker and your contractions are a little bit slower and less as forceful, then you're going to use less oxygen. Same thing with the calcium channel blockers. So calcium is one of the electrolytes. So here we're just reducing the electrical potential, hence reducing the force of the contraction. Antiarrhythmic. So we have a regular dub-lub sound that can be thrown off. So digoxin or lanoxin can be used to regulate heart rhythm. Beta blockers as well. If your heart is too forceful, we can slow it down to a lower rate, hopefully anywhere between 60 and 100. That's the normal range. And lastly, we can affect the sodium, potassium, and calcium channels within the heart. Antihyperlipidemic. So lipids are fat in the blood. So anemia is a blood condition. So in this case, we're talking about cholesterol. So cholesterol, these are lipoproteins. So we have low density lipoproteins and high density lipoproteins. So we have lipoproteins. So the protein part is going to be heavier. So that's like muscle. The lipo part is going to be lighter. So that's like oil and fat. So lighter in weight. So if we have low density, that means there's a higher proportion of fat. Whereas if we have high density lipoprotein, we'll have higher percentage of protein. So the bad cholesterol is LDL. The good one is HDL. HDL actually circulates your bloodstream and brings the bad fats back to the liver for processing. And as you know, we don't absorb fats directly into the bloodstream. We don't absorb fat into the bloodstream. That goes to the liver for processing in first pass metabolism through the intestines. Fat is actually absorbed in the lymphatic system, and the lymphatic system will dump it straight into the blood supply, systemic blood supply, without going to the liver first. So the drugs we use for lowering cholesterol prevents our body from making its own. So HMG-CoA reductase is the enzyme that makes cholesterol, so we're going to block its action. Antihypertensive. So high blood pressure is 140/90. That's 140 systolic over 90 diastolic. And all the drugs we mentioned previously are going to be good choices to reduce blood pressure. Thrombolytic versus anticoagulants. So anticoagulants are going to prevent clots. But once a clot has formed, anticoagulants won't really help it. So a clot must form through an enzymatic process, and there's 13 different steps that have to take place for a clot to form. So once a clot already forms, you're going to have to reverse that. You're going to have to give an enzyme that will actually dissolve the clot away. So the enzyme that we've isolated is alteplase, or ATP. If you have a blood clot, let's say it's in the brain, they can actually administer alteplase under microscopy, and they can see that clot physically dissolving away from the thrombolytic action of the drug. Very rarely used are vasopressors. So these are used to increase blood pressure. So not a lot of problems if you have low blood pressure. The only problem is fainting spells, you hit your head, and that'll be the injury. But internally, not too big of a problem if you have low blood pressure. So they really don't treat it until they have to. All right, that concludes cardiovascular agents, A, B, C, D, and D. Let's go on to dermatological agents. So things to treat the skin. So the top layer of skin, that epidermis, does not have a blood supply. However, it's highly absorbable. It can absorb ointments and creams. So normally ointments are stronger than creams. Your body can absorb oil-based things a lot faster than water-based, as in cream. So many things can happen to the skin. So horny tissue, so too much keratin of the top layer. You can have eczema, which is an autoimmune disease, psoriasis, usually in young adults, similar autoimmune disease that affects the skin. Acne, fungal infection, viral infections, and then just general conditions like hives, wheals, rashes. So many different conditions that can occur to the skin. Electrolyte agents. So what is an electrolyte? Well, it is a molecule with a uneven charge. So it'll carry either a positive or a negative charge. And it could be a +1, +2, -1, or -2. So cations are positive charge ions. They include sodium, potassium, calcium. So for calcium, it has a +2 charge. Sodium you usually find outside the cell, and potassium on the inside. So all day long, your body is pumping potassium inside and pumping sodium to the outside. And what this does is it creates a concentration gradient. So when you open the floodgates, the potassium will flow out and the sodium would flow in. Anytime you're moving anything with charges, you just created electricity. So that's how your neurons fire and how your nerve impulses propagate. Anions are negative, so chloride is usually outside the cell, and bicarbonate, the conjugate of that is carbonic acid, but for us that acts as a buffer. And what a buffer does is it can accept a lot of acid or a lot of base without changing the overall pH. And the way they're able to do that is they can act both as an acid or a base. So if there's excess acid, it'll act as a base to neutralize it. If there's excess base, it'll act as an acid to neutralize it, hence not changing the pH. So definitely in the blood, we must maintain blood pH at 7.4, and bicarbonate helps us do that. Some common electrolyte solution, we got sodium chloride, NS, which is 0.9% sodium chloride. Lactated ringer solution, so this is isotonic, so it's balanced and safe to administer intravenously. It has a mixture of electrolytes. D5LR, so this is both 5% and LR, so it's hypertonic. If you are dehydrated, they might just give you NS. But if you're severely dehydrated and all your cells lost water, then they'll give you D5LR. So the salt will stay on the outside to hydrate you, but once dextrose enters into the cell, it'll take with it some water. So that's how we'll rehydrate you from the inside. And here I just add on polyion. Just there's a lot of different manufacturers that make different electrolyte solutions. All right. We are almost done with this chapter. So up next, we'll get into part 4. So thank you everyone again for joining us. We'll see you next time, part 4, for the conclusion of common drugs and their uses. Thank you guys. Have a good day.